Dr. Zainab, we can start now.
Okay, Assalamu alaikum everyone. First of all, thank you so much for accepting our invitation. So I'm not gonna go into the detail कि इससे पहले हमारी क्या लड़ाई हो रही थी, लेकिन I just want to really appreciate that you gave us some time and you're presenting. I think before we start, I just want a quick introduction. I mean, we've given some details in your bio as well, but thoda sa I would suggest an intro about especially your area of research before we start the presentation for today, so that the students, especially the PhD students and other audience who would be interested in your research and they want to know your area of research, probably they can get an idea what you've been working on and what are your plans next, so that if they can have an idea on that, especially in terms of what to expect from you in future, probably it would be a good idea that we start from there. So over to you, and thanks again for joining us.
All right. Thank you very much, Dr. Zainab. All right, assalamu alaikum everyone. So as Dr. Zainab mentioned, my name is Rizvi. I'm a faculty member at SDSB, and I'm primarily a faculty member in finance. So I have a PhD in Islamic finance. So my area of research started off as mainly focusing on Islamic finance and Islamic Muslim majority countries, but primarily in the areas of financial economics and financial markets. That has been my primary area of research for the first 5 years of my research career. For the last 3 years, I've actually basically taken a slight change, and nowadays I'm primarily working on policy actions, and that's in economic policy actions, primarily central bank policy actions and its impact both on economics as well as financial markets. The shift is primarily because of my recent group of co-authors, who are primarily from different central banks across the developing and emerging countries. Even this research, so basically this is a paper which is a joint paper. It's myself and it's Dr. Kasum Patharak. Dr. Kasum Patharak is from Central Bank of Sri Lanka. He is in their economic research department. So here I would like to give a disclaimer that all the views or all the analysis that will be presented is purely is an opinion and is the other views of myself and Dr. Kasum as independent individual researchers, and this is not an institutional perspective either of LUMS or of the Central Bank of Sri Lanka. So basically what has happened is, and what we're trying to actually do, the COVID-19, all of us are living through it. And it's a once in a century kind of a situation. The last time we had the Spanish flu crisis, which was a pandemic, and now after nearly 100 years, we're into the COVID-19. There is an immense amount of literature which has evolved over the last year and a half, which talks about pandemics and financial markets, how COVID-19 has impacted the financial markets, how has the response to COVID-19 impacted the financial markets, how have the lockdowns, how have the restricted movements, how have the vaccination rates, the travel bans, infection rates, all of that have been focused and quite delved into with quite a lot of detail in the last year and a half. Now, one thing which across the pandemic literature is missing is research which focuses on the pandemics and the economic indicators. And there is actually a very simple explanation for it. The economic indicators frequency is not as high as financial market data. Economic indicators, at best, we would find them on a monthly basis, ideally on a quarterly basis. So we never had enough data points in economic research to actually start delving into trying to find out how the pandemic is impacting the economic indicators and how the response to the pandemic has been impacting the economic indicators. Now, what we noticed over the last year and a half, there has been an extraordinary range of policy responses by governments and central banks across the board. So it's not about focusing on Asian or focusing on European or North American markets. Across the board, there has been a huge array of policy actions that the government and policymakers have taken all over the world. Once in a century, our economists, economic systems, our economic structures have evolved in the last century. So this is uncharted territories where all the policymakers have been operating. And it's not only about the central bank doing anything about it, and not your fiscal managers or your regulators. It's about coordinated. Last year in March, when the responses started happening, they were in silos in some parts. But then very quickly, all regulators, all governments realized that it needs to be a very coordinated action across different policy makers. So there has been quite a lot of coordinated monetary and other policy measures that have been taken. And so they have been different. So there have been focused on large economic stimuluses. There have been blanket economic stimuluses, which have come in, like unemployment benefits across the board. There are healthcare benefits across the board. There are freeze on interest recovery on loans. There have been these large economic stimuluses, and then there have been very targeted interventions, which are specifically focused either a very specific sector or a demographic. If you look around in Pakistan, we've had specific policy actions targeting, for example, the cement sector, the construction sector. There have been specific policy actions which have targeted the people living below the poverty line. So there have been targeted interventions, as well as there have been blanket across the board interventions. All of these policy actions and interventions, what they actually do is they exert some short or some medium-term impacts on economic variables. We're not talking about long-term right now because it's been 1.5 years. We don't know yet or their long-term impacts. Now, at the same time, with all of these measures that have been happening, it's normally the central bank which has been taking the lead on it. The central banks, majority of the central banks' primary focus or primary role is on inflation targeting. Especially in most of the developing countries, one of the major objectives or core policy roles is inflation targeting. So this whole study, what we'll talk about over the next 15 minutes, is with that at the back of our mind, right? So two things. The central bank's main policy, main objective is inflation management. Two, there has been coordinated policy measures across the board, which can be classified into different and multiple categorizations. So there are basically two questions that we have tried to address. So remember, so my co-author is a pure policy economist working for a central bank. So actually this paper is more aligned or more bent towards a more policy impact. And that's what I've been working over the last year primarily. So we talk about two things. So what we're trying to find in this is two things. First question is, there have been so many different policy measures taken. Did these actually policy measures and interventions assist in controlling inflation? That's the first question. Tons of actions and interventions have happened, but did they actually achieve their objective? And then, if they did, and from this armory of policy actions across the board, which ones were more effective or which ones were not effective? So that going forward, we have a plan of action for these for policymakers on what may be more effective. Remember, every new crisis is unique, but then we always learn from our actions from the previous crisis and try to make a relatively more informed decision. Now, the scope of the study is a preliminary exploration of various measures' effectiveness on price stability, and it is understanding the nature of each policy intervention and its impact on the CPI in our sample countries. Our sample countries. Now, sample countries we've restricted ourselves to the SAARC member countries. A few reasons for it. SAARC is nearly 20% of the world population. Its economic growth has been in excess of 4% annually since 2000 for the last 2 decades. And most estimates of its recovery post-pandemic is expected at 7% growth in 2021. Now, our focus was on the SAARC countries. One of the reasons was also my co-author's affiliation being SAARC member countries as well. And we're primarily looking at the 5 major economies. So it's Bangladesh, India, Nepal, Pakistan, and Sri Lanka. You have Maldives and you have Bhutan as well. But then again, their data is not available. The time period we restricted ourselves is March 2020. That's when the pandemic came in, and up to May 2021. Now, if you look at the data, so what we actually did was we went through these countries' entire history during this time period. And we actually went and found out what exactly the governments did. And what we found was that there were 62, 128, 36, 28, and 47 policy announcements and actions in Bangladesh, India, Nepal, Pakistan, and Sri Lanka, respectively. Now, these policy actions are classified under 4 different categories. You have fiscal actions, you have monetary actions, you have direct aids and grants, and then you have financial actions, which are financial regulatory kind of actions. So we've classified them under these 4 broad categories. And these 4 broad categories are not classified by myself or by Dr. Kasum, but it's actually the 4 broad classifications by any IMF or World Bank standards when it comes to policy actions. And you will see the panel A in the table, country by country, which country has used how many of these. And this is actually very interesting. If you look at it, all of the countries, there's no set pattern. If you look at Bangladesh, for example, Bangladesh has relied mainly on financial actions, majority. India has actually been financial and fiscal measures. Nepal has primarily relied on aid grants, and fiscal actions. In Pakistan's case, it has been direct aids and grants, which is the majority. And while for Sri Lanka, it's either been financial actions and fiscal actions. All right. Now, on a secondary, so these are types of policy action. On the secondary level, what we did was we then classified them under 5 nature of policy actions. Were they budgetary support actions? Were they credit support actions? Were they income support? Were they pure regulatory? And whether they were healthcare support actions. So that's the nature of those policy actions that has been undertaken. And that's where, and in panel B of the table you have actually shows you the breakdown of those according to each country. Again, each country took a different path. In Bangladesh case, majority of maximum policy actions were taken under credit support. In India's case, it's mainly regulatory actions. Nepal is more towards income support. Pakistan is more towards credit support. And while Sri Lanka was again more towards regulatory actions in terms of the nature of the policy announcements and actions that have been undertaken. Now, it's a preliminary study. So naturally, we've primarily used a binary dummy variable for policy intervention, and we've used monthly data. This is a very simple equation, and we relied on fixed effect pattern regression with global standard errors, basic econometrics. I'm not going to waste time on this. Now, basically focusing on the findings. Interestingly, what we found out was that it's only the monetary policy and financial actions that had a significant negative impact on CPI. And that's what we're trying to find, whether these actions did assist in controlling inflation. So interestingly, it's only the monetary and the financial actions which have significant negative impact, which means controlling inflation. For fiscal measures and grants and aids, our findings are relatively inconclusive. Another variable which we used to control was the stringency index. Now, the stringency index is primarily an index which is aggregated measure of the government lockdowns, travel restrictions, basically the COVID response of the government in terms of movement of goods and movement of humans. So again, the stringency, whether the lockdowns, because a lot of debate has been happening, that the more stringent the government is in terms of its lockdowns and restriction of movements, that is a contributing factor to increasing prices. Our finding suggests it's insignificant. It doesn't matter, right? Or at least in the sample or the data set we are using, it doesn't have any impact. Now, this is the summary results that we found out, which talks about it. So, if you notice, there's another control variable which we've used, which is the COVID support, and that again is an aggregate measure of the COVID support. So, COVID stringency and COVID support are two indices which are easily available. They're Oxford Economics data, and which is more aggregate measure of stringency of support by the government. Now, so if you look at these findings, so these findings primarily look at the type of policy actions. Then, as I said, we further classified them into nature of support. And what we find out is that in the SAARC countries, there is a significant impact of credit support and healthcare support. So it's primarily the credit support function policies and healthcare support policies which help in controlling inflation or controlling prices in these economies. Logically and rationally, that is what makes most sense. So the credit support was primarily with fees on interest rates. There was a fees on recovery of interest on loans. Healthcare support was providing free healthcare, subsidies on medicine, subsidies on hospital bills. So all of those fall under healthcare. And naturally, with the health, with the pandemic, which is rooted in a healthcare disaster, naturally healthcare support was expected to have played a major significant role. Now, interestingly, when you look at the magnitude, it's the credit support which has the larger magnitude. And understandably, there has been a huge impact on of COVID-19 on the credit risk in the financial systems, and which essentially in the whole economy. And actually, credit support measures has helped in controlling the broad economic indicators and then your prices as well.
Sorry, I ask a question. Sorry,
please.
It's very interesting topic. It's very relevant because I think inflation, everywhere people are talking about it. We don't know what the impact will be. There's a lot of money printing going on as well. But there's one sort of debate that is going on a lot, is that the way CPI is calculated is sort of maybe doesn't do justice to. So there's a lot of recently talk of hyperinflation, even in the US. And the argument is that maybe in CPI is, let's say, increasing by 5 or 6%, but there are some assets that are already in hyperinflation, for example, property markets. They are, the valuation of housing everywhere is growing exponentially, and materials used to construct housing are also going up very sharply, but they are not included in CPI calculation. So is there a case over here, maybe stocks is another one that, asset classes are experiencing somewhat of, let's say, hyperinflation, prices are doubling, going up very quickly because of COVID. And COVID has exacerbated that, but CPI is still relatively stable. So is this something topic that's being looked at?
Yeah. So, and that's true, and that's a huge debate everywhere in the world. That your CPI or even your core CPI or food CPI, That's not representative of actual realities on the ground. The challenge with that is standardized measurement. Because if you start talking about CPI is again a standard measure which is comparable across states, across countries, the current measurement scale. To factor in, there's another study which I did, and that was I think published yesterday, and that's focusing on policy actions and how the policy actions have helped in stabilizing the equity markets. And the main idea is as an investment asset class. So did it give confidence to investors? Did it give confidence to the general public that your investments are relatively safe? The findings are slightly different in that case, but then again, for a country specific, you can do it. If you we may be able to find basically commodities. So we go into real estate and commodities, and we create a local index. So there would be local indices available. But then across comparison, more larger generalizability of a study is unless you have a standard benchmark, standard measurement.
And these benchmarks don't exist right now.
Not in developing. The main issue is you can find these kind of benchmarks for US. You can actually find them down to counties. Even in some of the European countries, we can find these. But the moment we move out of the developed world, they don't exist. Yeah. So for developed market, there is research which is talking about all of this, and in context of COVID-19 as well. My focus is primarily on developing countries, and that's where we don't have measures.
But we are experiencing the Pakistan property market is experiencing a lot of inflation.
Massive.
They are up prices.
Again, now that is one of the factors that is the theory is the logic says is because of the targeted policy action that was taken for real estate and construction. So the government came up with a policy intervention which said tax income disclosure exempted, and secondly, it said no restrictions on construction and basically cement sector, which basically was a very targeted subsidy or targeted policy for a specific sector, which was the real estate and the construction. So naturally, probably that policy may have contributed hugely to that sudden or near doubling of prices all across the major urban centers. And then the Naya Pakistan housing scheme came in the Pakistan's case as well. So that was again a stimulus for the cement and steel industry. But again, cross-country analysis is a bit difficult, mainly because of the standardization of the measures available right now in developing and emerging countries. Yes, in the EU context, we can do it. In the North American context, we can actually do it to an amazing level down to the states and counties. Unfortunately, not in our countries.
Yeah, we have another question.
Yes, please.
This is from Moeed. Assalamu alaikum. Thank you for the wonderful presentation and a very interesting topic for discussion. To what effect do you think that the supply limitation and international restrictions impacted the supply of goods, and whether the cost push factors of inflation are an interesting area for further research?
Okay, so there theoretically, yes, the global limitations and restrictions would have played a role, and that's why we've tried to use a COVID stringency index and a COVID support index. So this is the aggregate index which does look at the restrictions on movement of humans and the movement of goods. And the movement of goods, naturally, like in Pakistan's case, it's not you remember we had a ban on the inter-province travel. And then we had a ban from the government on restricted use, or basically like down to 1/5 of our airport and our ports capacity. That actually impacted the supply chain as well. And it's not only in our Pakistan's case, all over the world we are. So some of those restrictions are covered under this COVID stringency broad index. But yes, if we can break it down to specific further measures, there would be probably some very interesting findings out of it. We might find some really interesting stuff. But again, the idea is, what Dr. Sam was mentioning, going back to it, the challenge having standardized measurements for it. For one country, we may be able to do it, but if you want to have an implication of that finding on a more broader scale, we need to actually have measures which are across the board, across different states, different countries, available to actually study how it may impact on a broader scale.
That's it. G. Mohit, yes, Mohit says thank you.
Okay. All right. So now the concluding remarks. The idea is that the hypothesis was price stability, proxied by the CPI, would react heterogeneously to different policy actions. And yes, some of our findings do suggest that. In each of these countries in our sample has followed a unique mix of the kind of policy actions they've taken and the nature of policy actions that they've undertaken. And the monetary and financial regulatory actions have been significant in maintaining the price stability, and specifically actions which have targeted credit support and healthcare support are more apparent in our findings. Now, I need to caution something. Insignificant policy actions doesn't mean that these policy actions were not effective at all. Because if you look at the literature on fiscal policies impact on price stability, it's long term. Fiscal policies, there is a plethora of literature which talks about the fact that fiscal actions and fiscal policies, they end up impacting your prices with a 2 or 3 year lag. We are just 18 months into the pandemic. We don't have enough data to say that fiscal policies are useless. Fiscal policies may actually have a more significant impact, but we may only be able to measure their impact probably a couple of years down the road. Secondly, all of these policy actions that we're talking about, they are interlinked. It is a network. There is a web of all of these policies. It's not like that the monetary policy or an aid or the grant action, or be it a healthcare support or be it credit support action, that they would independently be impacting. They are interconnected. These policy actions and interventions across the spectrum, they work in tandem. And it's interestingly, and especially during the COVID, and that's witnessed across the board, across all countries, that what we noticed is there was coordination councils, coordination committees in every single country. In all these South member countries, there were COVID-19 coordination groups. In Pakistan, we had the NCOC, which was the nerve center for all responses. It wasn't only about the healthcare response, it was about coordinated responses across policymakers, across the upper echelons of government. And so there is a very complicated web of dependence between all of these policies as well. And to untangle that, it will take some time. We need more data to untangle their individual impacts. The research and policy effectiveness in COVID-19 times is scarce. There is a huge demand for it. Our study is primarily a preliminary study. There's a limitation actually to it. So one major limitation that we have is we've only used the policy announcement. We haven't used the size of the policy intervention and the intensity of the policy intervention. That is something which would be maybe more interesting to look at. Depending on the size or impact, the dollar impact, the dollar size of the policy action and announcement, how does that impact in controlling the prices? Then there may be more proxies, more alternative measures that I think are the question Mohit had asked. Yeah, so what Mohit had mentioned, there would be more measures available to look at this as well. And that's about it. Thank you very much. If there are any questions, comments.
Right. Thank you so much, On. Just one quick question, probably a clarification in that sense that you've mentioned the timeline for your research. And I was just wondering, how do you put that stop? Because that I'll be collecting the data up to this point, especially when we are saying, we're using the term post-pandemic, but we're really not in post-pandemic, and there are still, we're looking at the interventions, changes in policy and things going on, especially if you look at some of the third, fourth, fifth, sixth waves expected and going on as well. So how do you frame that, the timeline?
All right, so primarily on two factors. The reason why we restricted ourselves up to the May 2021 was in two factors. One was, this was the minimum number of data points we needed to basically have a relatively more robust inquiry. Any panel data, if we wanted to, because since we wanted to use fixed effects, considering the unique nature of each country's economic structures, any data point which would have been less than 12, basically T less than 12, wouldn't have worked for us. Our alternative measures, we could have, so like in panel data, your primary is the pooled OLS, which wouldn't work here because of the 5 different countries. The option was fixed effect, or going into GMM. GMM again requires less T. You could have done with 9 months of data, but we would need at least for 30 plus countries. The N needs to be at least 30 plus. So one factor was, what is the minimum threshold to be able to analyze and with some confidence say that, you know, this is what our findings are. Two, if you remember that, we actually started work on this paper roughly in June. And if you remember, that was the peak summers in South Asia, and the numbers had actually gone down. So we wanted this research to have some of our first cut findings available somewhere by July end. The main reason was that's when normally in August the monsoon hits this part of the world. So Pakistan, India would have faced a monsoon, including actually Bangladesh. And that was when most of the health experts were talking about the fact that with that, we may see another wave coming in. So we wanted our first cut results out by July, somewhere around 3rd week of July, so that the next cycle of policy actions that is undertaken, we have some kind of prior review of what has been done and what worked, what did not work. So these were the two major factors on how we decided on the time period. We are still pandemic. We may have to revisit this whole findings a couple of months down the road with the new waves coming in and out.
Right. So we have another question from Abdullah here. Have you considered using one, inflation perception index, and two, commodity prices index?
All right. For commodity prices, yes, we've used it, but it's a different paper. We've not brought it here. So this is purely, so basically, this is part of series of studies. There are actually 6 of them till now. And each of them are focusing on a different. So there's one which focuses on the financial markets. There's one which focuses on commodity prices. Inflation perception index, actually no, but that's actually a very interesting idea. I'll probably look into that. Yeah. So, but that might be, but with the inflation perception index, that actually may provide some very interesting insights. Thank you for that.
Okay. Do we have any other questions? So you have to type your questions because Facebook Live, as you know, doesn't allow you to probably raise hand. Okay, I think that's about it. Thank you so much, On. It was wonderful to have you here. And we would like to see more papers as you're working on them in this series as well. It would be great to have you back with, of course, a better menu as well. So
that's more critical.
Yes. So inshallah, see you again sometime, probably in spring. I hope so. Yeah.
All right. Okay.
All right.
Thank you very much.
Thank you so much. Really appreciate it. Thank you everyone for joining us. Allah Hafiz.
Yes.